There are many kidney disorders, such as kidney stones. Whenever the urine becomes concentrated, such as crystals of many salts like calcium oxalate, calcium and ammonium phosphate, uric acid, are formed. Such large crystals cannot pass in the urine and form hard deposits called kidney stones. Most stones start in the kidney, some may travel to the ureter or the urinary bladder. There are basic causes of the kidney stone is related to age, diet, mostly the leafy vegetables, excess amount of the vitamin C and D, and other urinary tract infections, and less intake of the water is the big reason of it. Symptoms of kidney stone includes uh, pain in the kidney or the lower abdomen, vomiting, frequent urination, and foul smelling urine with blood and pus. There are the two ways by which we can cure it. One is the large intake of the water, and the other one is the lithotripsy. In the lithotripsy, it's a method of removing the kidney stones. In this method, non-electrical shock waves from the outside are bombarded for the removal of the kidney stones. And in this way, these stones can, you can say, can be easily removed from the kidney. There are the other reasons uh, uh, a person can feel whenever the kidney is not working properly, such as the shortness of the breath, irregular heartbeat, chest pain, pressure, and the mostly the diabetes are having the 10% higher rate of the kidney. There is a complete or the partial failure of the kidneys. The patient may go for the dialysis and the kidney transplant. Dialysis means the cleaning of the blood by the artificial ways. It can take place into the two ways. The first one is the peritoneal dialysis. In the peritoneal dialysis, there is a space that is present in the peritoneal you can say cavity, which is a space around the gut, and the cavity is lined with the peritoneum, and the many blood vessels are there, and basically directly the blood, you can say the peritoneal blood will diffuse fluid into this cavity, and in this way the other waste material can be drained out. So peritoneal dialysis is the one method by which the person can purify the blood out of all the waste which the kidneys are unable to purify. So this is the one method that we call the peritoneal dialysis, and here is a video which can clear the concept of peritoneal dialysis more to you people. So let's have a look of this video first.
Most popular home dialysis in the United States is peritoneal dialysis, often just called PD. It was invented in the days of bell-bottoms and rock and roll, so it's had 40 years to be perfected. Today, more than 45,000 people in the US do PD. To do PD, you need an access port called a PD catheter near your belly button. Getting this catheter requires a minimally invasive surgery. Most people go home the same day. Here is what a typical day looks like when doing PD using an at-home machine. Before going to bed in the evening, put on your favorite PJs. Carefully connect the PD machine to your PD catheter. Program the treatment by pressing a couple of buttons. Then hop into bed and start counting sheep. This bedtime routine usually takes less than 15 minutes. After getting 8 to 10 hours of sleep, wake up and disconnect the machine. That's it. You're ready to conquer the day. You can work, visit friends, exercise, enjoy hobbies, and even travel. When you're ready for bed, just repeat the ritual. There is also a way to do PD by hand. If interested, your doctor can describe how this process works. So, what's the catch? Well, like all medical treatments, there are some considerations. PD requires that you do the dialysis treatments on your own or with a partner. Your dialysis center gives all of the training you need. Also, PD requires supplies, so you'll need a place to store them. And sometimes you can get an infection, but this can usually be treated with medications outside of the hospital. While there are considerations, PD has many benefits. PD is an effective treatment. It cleans the blood every day, while hemodialysis usually only cleans the blood 3 times a week. PD is also gentler on the body, including the heart. Plus, some people have a little kidney function remaining when starting dialysis. PD can help keep it going and going. And
The other way is the hemodialysis. In hemodialysis, patient blood is pumped through an apparatus called dialyzer. The dialyzer contains long tubes, the wall of which act as a semi-permeable membrane. Blood flows through the tubes while the dialysis fluid flow around the tubes. Extra water and waste move from the blood into the dialysis fluid. The clean blood is then returned back to the body. So have a look of this video first.
Is the process of cleaning the patient's blood outside the body. The blood is routed through a dialyzer to clean it and is then returned to the patient. The process is controlled by a hemodialysis machine which, amongst other things, pumps the blood and dialysis fluid around the circuit, adds in an anticoagulant, removes excess fluid, and regulates the entire cleaning process. The dialyzer comprises a large number of capillary-sized hollow fibers. To remove the toxins, a special dialysis fluid is added into the filter and bathes the fibers. The blood flows into the fibers. Metabolic toxins, urea, and other small particles pass through the membrane of the hollow fibers and are thus filtered out of the blood. By contrast, vital substances and blood cells are held back due to the small size of the pores. At the same time, excess fluid is removed from the patient's body. The transfer of metabolic toxins through the membrane into the dialysate is based in part on the principle of diffusion. So what form does the treatment take? Hemodialysis is usually carried out in a dialysis center. Patients first undergo an operation to implant a shunt between an artery and a vein in the lower arm, which provides access to their blood. Hemodialysis is usually performed 3 times a week and takes 3 to 6 hours. Modern hollow fiber dialyzers have greatly improved the efficiency of the treatment. Thanks to industrial production techniques, it is now possible to manufacture dialyzers that exhibit high cleaning performance in large numbers.
Another treatment for the end-stage kidney failure is kidney transplantation. It is a replacement of patient-damaged kidney with a donor-healthy kidney. The donor may be donated by a living donor or a deceased donor. The donor may or may not be a relative of the patient. But before the transplant, the tissue protein of the donor and patient are matched. If the tissue proteins are matched, then the donor is able to give the kidney, and the average lifetime for the donated kidney is 10 to 15 years. When a transplant fails, the patient may be given a second kidney transplant. In this situation, the patient is treated through dialysis for some time, but still problem arises after the transplant that may include transplant rejection, infection, imbalances in the body salts, which can lead to the bone problem and the ulcers. So the best way is to save your kidney health. Just do all the good which can enhance your own kidneys for the longer time. Stay blessed, everyone.